and that will be happening in earnest in the weeks and months to come. So we'll take a few questions if you have. Okay, you're so eager. I got to get it.
We have a relationship at this point. First off, happy Thanksgiving as well. But quick question: what are your thoughts about and not related to the Minnesota welfare scandal, but specifically, what are your thoughts about President Trump calling Governor Walz retarded?
Well, look, that's not the word that I would choose. I think his reaction was probably a spontaneous one to the enormous amount of fraud that was announced there. We're thinking it may be, could be $2 billion. Congressman Emmer, of course, represents that state, and it is an outrage. And we're told that this was funding terrorist organizations in Somalia, and so it's a lot to look into. I mean, all of us, when we heard the news, we reacted in different ways, and you know, that's not the word I would choose. But I think everybody understands how absurd and crazy that is, and how Congress has an immediate obligation to look into it, and the administration is as well, and we're going to get down to the bottom of that. Governor Walz appears to have a lot to answer for, so it was a really stupid thing.
Thank you so much, Mr. Speaker. You talked a lot about your accomplishments, and one you didn't mention is the SAVE Act, which the House has passed twice. It's still awaiting action in the Senate for some reason. But many are still asking when an in-person, same-day, hand-counted paper ballot measure will be passed, and will that be done in time for the 2026 election?
Yeah, I've been asking that myself. I think that would be a really important measure to eliminate you know, fraud in elections. And there is some element of fraud in every election. We all know that. And we have a duty as lawmakers to prevent as much of that as is humanly possible. The SAVE Act has been a big priority of ours. I think I did mention it in the list, but it was so long. I certainly intended to. It's an important measure, and we would certainly love to get that signed into law. We need a little help in the Senate, of course, to do that. We don't have control over all elections. The states in our system, as you know, have a lot of responsibility over that, and that is federalism. We support that. The states have that in their jurisdiction of authority. We don't want to federalize all elections because that could open up a whole other can of worms. But with regard to federal elections, at least, you know, elections for Congress and Senate, we do have some say. And so the SAVE Act would be an effort to ensure that we eliminate as much fraud as possible. I've obviously been a big champion. I was a co-author of it before I became Speaker. We've been working on this, and we'll continue to try to get it done. So it's a big priority. Yes,
Mr.
Speaker.
Yes,
Speaker.
yes, ma'am.
Yes, ma'am.
Thank you, Mr. Speaker. Elise Stefanik wrote on social media this morning that you are protecting the deep state by not including a provision in the Intelligence Authorization Act. What's your reaction to this claim, and why is House Republican leadership not united on this?
Well, all of that is false. I don't exactly know why Elise won't just call me. I texted her yesterday. She's upset that one of her provisions is not being made, I think, into the NDAA. I explained to her on a text message as soon as I heard this yesterday. I was campaigning in Tennessee, and I wrote her and I said, what are you talking about? This hasn't even made it to my level. The way regular order works is, and I think she should know this, we'll be talking about it, I'm sure, today. The way this works is that it has to go through committees of jurisdiction if it will be attached to the NDAA. And this provision that she's working on, I think, is under the jurisdiction of judiciary. And so there's a four corners engagement and agreement that's required. You all know how this works. The two chairs and the two ranking members of the committees of jurisdiction, which would be judiciary in the House and Senate, all have to agree, or at least 3 out of 4 have to agree. It's typically unanimous to make sure that it makes it onto the bill. Well, in this case, I found out last night, this wasn't even on my radar, that apparently didn't happen. I haven't even talked to those chairmen. I haven't had time because I got in late last night. But apparently those four, the two chairs and the two rankers in both chambers did not agree, and so that provision was dropped out of the NDAA. It doesn't mean it can't become law or even that is a final decision. But I sent my friend Elise a text last night, and I said, can you find out what the issue was, and I'll help you resolve it. I support her provision. I mean, I would vote for it. I think it's smart. And I'm not sure exactly why it wasn't included. So I don't know why she's frustrated with me. I literally had nothing to do with it, but I'm happy to roll up my sleeves and help her. I want everybody to be successful, and we're going to try to make the bill as best it can be.
On the Caribbean boat strikes, the administration has acknowledged that there was a second strike in that attack in September, but they have not said if there were any defenseless survivors. Should they release the video to Congress, the unedited video to Congress and to the American public? And two, if the defenseless survivors were killed, would that constitute a violation of the laws of war?
I'm not going to prejudge any of that. As you know, both of the Armed Services Committee and the Senate and the House will be having hearings on this to review, and that's their role. I have been listening. Again, I was pretty busy yesterday, didn't follow a lot of the news, but I caught up a little bit early this morning. That my assessment of this, my understanding is that most of the people that have looked at this, at least in a preliminary review, say that the admiral who ordered the second strike thought it was necessary to complete the mission. He's a highly decorated, highly respected admiral in the Navy, and he made that call. And so, we're going to have to look at that. I'm sure Congress has a right to look at it. I don't know how much of the tape should be released because I'm not sure how much is sensitive with regard to national security and all that. I haven't had a chance to review it, so I'm not going to prejudge it. But I will say that, it's not an unprecedented thing. One of the things I was reminded of this morning is that under Barack Obama, President Obama, he had, I think, there were 550 drone strikes on people who were targeted as enemies of the country, and nobody ever questioned it, okay? And secondary strikes are not unusual. It has to happen if a mission is going to be completed. So I haven't reviewed the scope of the mission. I haven't reviewed that particular strike. I don't know what went into the Admiral's decision matrix. But it's something that Congress will look at, and we'll do that in the regular process and order. I think it's very important for everybody to reserve judgment and not leap to conclusions until you have all the facts, and that's what we'll be uncovering. Yes.
Secretary has to testify.
Thank you, Mr. Speaker. The first note's a little bit self-serving. It's Giving Tuesday, and so just asking everyone to consider perhaps public television among the many worthy charities. Louisiana Public Television, one of the best.
Yes, there's a plea to give to public television for Giving Tuesday. Okay.
And then on healthcare, two of your members came out of the meeting just now and told me that it was their impression that the House Republicans are likely to get on board some kind of short-term extension for the subsidies while you work out long-term reform. They weren't members who love that idea, but they said it looks like that might be necessary. Where do you think things stand, and could something come before the House by the end of the year?
I don't know who you talked to, but they might have left early. I was up there for quite a bit today. We were talking about a lot of issues, and what I said, we didn't commit to that. What I said is, when you have, this is just practical, okay? When you have a razor-thin majority, which we have, this is not like the old days. In the old days, they had 30, 40-seat majorities, and so 4 leaders could go in a back room, create the agenda, and hoist it upon everybody and say, this is what you're doing. And if 20 or 25 people disagreed, they said, so what? Go jump in the Potomac. We're moving forward. Okay, it doesn't work that way, right? And when in an era of small margins, I literally have to get almost every person in the room on board. Now, healthcare is a very complex issue. And I don't want to point this out. Look, it is not the Republicans who broke American healthcare. Next week, we'll go into this in real detail, and I'll show you the whole timeline. The Democrats broke healthcare, okay? When they created the Unaffordable Care Act, 15 years ago, they promised you that everybody could keep your plan, keep your doctor if you want it, and that your premiums would be reduced on average by $2,500. Exactly the opposite was the truth, and premiums have risen in some cases 60, 80% over that time. They broke the system, and every time the Democrats have gone in to try to subsidize the broken system, they've spent more and more taxpayer dollars, and they've been wasted. The COVID-era subsidy only affects 7% of Americans, okay? All this hullabaloo is over 7%. Now, every American, 100% of Americans need their health care costs to come down. Republicans have ideas to do that. Now, what I've got to do is build consensus deliberately around the best ideas, and we've been working on that. The majority leader has been quarterbacking this effort with the chairman of the committees of jurisdiction, with the Docs Caucus, and with individual members who this is their passion, and they really spend a lot of time thinking and working on it. And we're pulling those ideas together, and there will be a Republican response to this, okay? So I can't project in advance what that will be, because I don't know what the consensus is in that room, but you will see our sleeves rolled up and that work being done in earnest this week as we bring all that together. I told everybody we are going to respond. We understand the need of bringing down healthcare costs and at the same time raising access to care and quality of care. The Republican Party is the party that can do that. The Democrats have demonstrated for 15 years they broke the system and they keep doubling down on the broken system, okay? Hey, and guess what? If you love your Obamacare, you'll get to keep it, okay? We're going to improve the system for Americans, and we have good ideas to do it. We have a lot of thoughtful people working on this, and we'll be pulling it together. So, no, the answer is no, I did not project any outcome of this morning. We were talking about the various ideas, and we're working right now. People are very passionate about this, and they should be, because their constituents understand the necessity of it. So we'll keep doing that. Thank you all so much, and being more elated today.
The Tigers.
Do you know that the Somali Autism Society, they actually work on helping Somalis get properly diagnosed? They're with the Minnesota Autism Society.
By the way, the fraudsters have
No,
put real autism claims at risk.
No, I know, but there's a charity that actually focuses to counteract the misinformation. Do you know about them?
The misinformation.
No, the misdiagnosis I meant to say. Like, there's actually really good. You should check them out.
We're working with actual Somalis that are impacted.
Yeah, I know. Yeah.